I was asked by somebody what the difference is between COVID, influenza, and the common cold. And I thought I would do a video to try and explain these because there's a lot of confusion, a lot of overlap. So let's just start out with saying that many of the symptoms between COVID, influenza, and the common cold overlap. And because of that, it's very hard to tell what is causing what without some kind of diagnostic test. But there are some important differences and nuances there that I think are useful for people. So let's start with influenza. Influenza refers to a specific virus, the influenza virus, and there is influenza A, B, C, and D. For humans, we worry most about influenza A and B, and there are multiple strains of influenza A and B. And people use the word colloquially kind of to mean anything, but it really means that virus causing a specific infection. And we sometimes abbreviate it by saying flu. The word influenza comes from the fact that there's this periodicity to it. In temperate climates like North America, the colder months are when we see flu activity increase. And in the summer months, it's at a lower level. And we have the opposite with the Southern Hemisphere, meaning their summer is our winter and vice versa. In tropical climates, flu usually circulates year round. And this is a disease that's been known since the time of Hippocrates. Hippocrates describes it, or the Hippocratic corpus describes it. And the word influenza comes from an Italian word for influence because that periodicity was thought at one time to have something to do with the stars and the pattern of the stars leading to illness. But obviously, we know now that it's caused by a virus. So, what does influenza cause? So, the symptoms that it causes are often fevers, chills, muscle aches and pain, sore throat, runny nose, cough. Of those, fever, chills, muscle aches and pain are very characteristic of flu. Now, that's an uncomplicated case of flu. A severe case of flu can cause pneumonia, can cause brain infection, can cause respiratory failure, and obviously death. So, influenza viral infections are on a spectrum. Some people have very mild symptoms that might just be a cough, sore throat, runny nose type of thing. Other people might have life threatening pneumonia, and some people may have no symptoms at all. So, that's influenza. And we obviously have vaccines, which I went over before, to protect against influenza, to diminish its consequences, to make it milder. And we have antivirals for influenza, and we have home tests for influenza. Now, COVID is a little bit different, even though there's overlapping symptoms. COVID refers to infection with SARS CoV 2, the SARS coronavirus 2. Now, this is a distinct viral family from influenza. Influenza is in the orthomyxovirus family. SARS CoV 2 is in the coronavirus family. And just like influenza, you have a spectrum of illness. Some people will get fevers, chills, headache, muscle aches and pain, runny nose, sore throat, sometimes GI symptoms. And you can't distinguish it from influenza without a test. So that could be the symptoms could be caused by either one. Obviously, if someone's been exposed to one or the other, that can help you, but you can't distinguish the two. And just like influenza, the spectrum of illness can range from these mild symptoms, runny nose or so, to very severe symptoms like pneumonia, respiratory failure. So, just like any respiratory virus, there's a spectrum of illness. And some people with COVID might have no symptoms at all. What's happened as with COVID is that it has become somewhat tamer because there's so much immunity in the population. So, the spectrum of illness has shifted to the milder side because of immunity in the population from prior infections, from vaccinations, from combinations of those. Plus, we have the availability of antivirals as well. All of that has made COVID tamer than what it once was. It once was much more severe than influenza. Now they're basically on par. So those are the two there. Now, the third thing is the common cold, and that's a little bit different because the common cold doesn't refer to one specific virus, one specific pathogen. The common cold is a umbrella concept or an umbrella term that subsumes a lot of different things that are causing kind of the same types of symptoms. And what are those symptoms? Runny nose, cough, nasal congestion, just kind of feeling crappy. The fancy medical word for that is malaise. Now, the common cold is not caused by one thing. There are probably about a dozen viruses that can cause common cold like symptoms, which the most common are rhinoviruses. Rhino is a Latin word for nose, just like a rhino has a big nose. Rhinoviruses, parainfluenza viruses, adenoviruses, RSV can cause common cold like symptoms. There are Coxsackie viruses that can cause common cold symptoms. Even mild cases of influenza would be causing the common cold, especially things like influenza B or C, sometimes are more associated with common cold like symptoms. Other coronaviruses, so SARS-CoV-2, we talked about being in a family of viruses called the coronaviruses. There are other members of that viral family, and they cause about 25% of common colds. That's actually how coronaviruses were first discovered, was they were finding this new virus causing common cold-like symptoms that had this characteristic shape on an electron micrograph with little spikes out of it that look like crowns, hence corona. So all of these different viruses can cause common cold-like symptoms, even though in some cases they can cause very severe symptoms. So when you say that something is causing the common cold, that doesn't really say what it is. It's just saying these are mild upper respiratory symptoms. And that's kind of how I use the word synonymously, that common cold, upper respiratory tract infection. And by upper, I mean nose, mouth, throat, not necessarily lungs. When it's in the lungs, now you're talking about a lower respiratory tract infection. You're talking about pneumonia. Even bronchitis is an upper respiratory tract infection. So that's what we mean by common cold. And there's all these viruses that I just named, including ones like COVID and influenza that can cause common cold. Also, some bacterial infections might cause common cold like symptoms as well. So, the early stages of pertussis or whooping cough, they call it the catarrhal stage. That is going to look like any upper respiratory tract infection before the characteristic whoop sets in. Mycoplasma, sometimes it's called walking pneumonia, that can also cause common cold like symptoms. So even bacteria can cause common cold like symptoms. So when people say there's no cure for the common cold, it's because the common cold isn't one thing. It's a cluster of symptoms that can be caused by many different things. So there's obviously not going to be one cure for it. So when you're thinking about upper respiratory tract infections, people often ask, what do I do? What do I take? So obviously, if you have influenza, there are specific antivirals that you can take. Drugs like oseltamivir or Tamiflu or Zofluza, which its generic name is baloxavir. Those antivirals will get you better faster. They are also important if you're have any risk factors for severe disease in preventing complications. COVID, if you have risk factors for severe disease, there are specific antivirals you can take: Paxlovid, Molnupiravir, Remdesivir. Those are what we would use in COVID. So different antivirals, those are specific treatments. But what about symptomatic treatments? What do I recommend people take? So you've got a whole cluster of symptoms, and you kind of have to address them separately. Not one thing is going to correspond to one drug. So non-steroidal anti-inflammatory drugs like ibuprofen or naproxen, those are good for reducing fever, muscle aches and pains, decreasing the pain from a sore throat. Acetaminophen or Tylenol is also useful to relieve aches and pains as well as to relieve fever. So I often will recommend people to alternate between an NSAID like ibuprofen and acetaminophen to make sure they're covering themselves with those. Now, for the other symptoms, the nasal congestion, stuffiness, there I recommend pseudoephedrine. So pseudoephedrine is something that's now behind the counter. It's still available without prescription, but because people can use it to make methamphetamine, you've got to ask for it. I don't think that phenylephrine, which is in NyQuil, DayQuil, those types of products, is that effective. So I tell people to take pseudoephedrine along with the acetaminophen and ibuprofen. That's my cocktail that I tell people to take. Zinc, there is mixed data for zinc. I would say zinc lozenges aren't going to hurt you. Don't put things in your nose with zinc because it can damage your sense of smell. And speaking of sense of smell, that was one of the characteristic symptoms of COVID, is losing taste or smell, which has now kind of gone away. That was one distinguishing characteristic of COVID, which now has become less and less common. But back to what I was saying, zinc in your nose, probably not a good thing. Zinc lozenges, they're not going to hurt. They may have help. They may help. There's not really good data to say that they're definitive, but I don't mind people taking zinc. Vitamin C, if you have a replete diet, you're not likely to get any benefit from vitamin C. The same is true for vitamin D. So, obviously, if you're deficient in vitamin D, you're going to be more likely to get respiratory tract infections. But taking vitamin D, if you're already replete when you're sick, is not likely to affect your symptoms. But people should be taking vitamin D every day as part of a multivitamin. Many Americans are deficient in vitamin D. So it's mostly antivirals for flu and COVID, plus ibuprofen, acetaminophen, pseudoephedrine for the symptoms, zinc plus minus. Make sure you take a daily vitamin, and that's basically where it all fits. So these are overlapping syndromes, hard to tell apart. But when someone says, "Oh, COVID is just the common cold," you can say, "Yes, sometimes COVID does cause symptoms that are the common cold, but sometimes it doesn't." And why does it cause symptoms that are on the level of the common cold? Because there's so much immunity in the population. So these things are difficult to tell apart. There are home tests that are available now that can test for influenza, for both influenza A and B, COVID, and RSV, which makes it easier to sort of distinguish these things. But there's a lot of overlap there. Hopefully, that was interesting to you to try to understand this kind of common dilemma that many people find themselves in.